diameters. So there will be three types of pelvic diameters: diameters of brim, diameters of cavity, and diameters of outlet. So first we will start with the diameters of pelvic brim. Pelvic brim have basically three types of main diameters. What are those? Antero-posterior, or also known as conjugate diameter, this one. Then oblique diameters, two oblique diameters are there, and one transverse diameter. Okay. So in gynecoid pelvis, the transverse diameter of pelvic brim is longest, that is oblique diameter 13 centimeter. Okay. So this is 13 centimeter. The antero-posterior or conjugate diameter, it extends from the sacral promontory to the symphysis pubis. So conjugate diameter will be straight, antero-posterior. Three conjugate diameters can be measured. When we discuss about AP or antero-posterior diameter, there will be three diameters. One is anatomical conjugate, which averages 12 centimeter and is measured from the sacral promontory to the uppermost point of symphysis pubis. Then there will be obstetric conjugate, which averages 11 centimeter and is measured from the sacral promontory to the posterior border of upper surface of symphysis pubis, which is 1.2 centimeter lower. This conjugate is of significance to the midwives because it represents the available space of passage of the fetal head through the bony pelvis. Then internal or diagonal conjugate.